Hello, my name is Alexandra, and I will be presenting our research on relational continuity of care among adults with vulnerable housing in a transitional case management program called Connect2Care, or C2C. C2C connects people with vulnerable housing and high acute care use to community-based care by overcoming access barriers, and this includes facilitating primary care attachment. This is important to establish relational continuity of care, which improves outcomes among the general population, but unfortunately has not been well studied among people with vulnerable housing. We aimed to assess whether adults with vulnerable housing experienced an increase in relational continuity of care after engaging with the C2C program. We used physician billing claims linked to 390 adults from the C2C program to evaluate primary care use and relational continuity of care within the year before and after C2C engagement. Participants with 3 or more visits to a general practitioner pre and post C2C were eligible for continuity analyses and considered regular primary care users. Our analyses demonstrated that overall, 15% of participants with fewer than 3 primary care visits in the pre-C2C period experienced an increase in primary care use and became regular users post-C2C. In addition, relational continuity significantly increased from pre to post C2C with both general practitioners and practice locations. However, these findings did not differ by patient subgroup. Furthermore, between 37 to 41% of participants experienced an increase in continuity to a higher quartile, and we plan to identify characteristics associated with this increase. In summary, primary care use and relational continuity of care at the provider and site level increased among individuals with vulnerable housing after engaging with C2C. These findings can add to our understanding of how primary care access and delivery may be improved among people with vulnerable housing to reduce health inequities, which may be achieved by incorporating case management interventions or elements of such interventions into our care system. Thank you for listening.